Let's talk about something extremely important, something many men unknowingly overlook, yet it plays a crucial role in your vitality, performance, and overall health. I'm talking about zinc, an essential trace mineral whose impact on male health is far more profound than most people realize. As a man, a deficient level of zinc in your body can directly contribute to many of the common sexual health challenges that men experience, including low libido, difficulty maintaining erections, poor sperm quality, and even fertility issues. Unfortunately, most men don't realize that these issues often do not stem from age or fatigue, but from a very preventable nutritional deficiency. Now, before you rush to the nearest pharmacy or online store and grab the first zinc supplement you find, perhaps something labeled zinc oxide or zinc sulfate, take a moment. Because not all forms of zinc are effective. In fact, some forms are poorly absorbed and can even be a waste of your money. I'll explain exactly what to look for, which scientifically proven forms are best for men's health, and also how you can get zinc naturally through your diet in case supplementation isn't necessary for you. Hi, I'm Dr. Fiona, sexologist and a urological surgeon. And what you're seeing right now is an AI avatar. With so many creators on YouTube using avatars and connecting with large audiences, I thought, why not give it a try myself? Technology is evolving rapidly, and as professionals, it's important we grow with it. So here we are. Let me know what you think of this avatar. Does it work well for you, or should I try a different style? Your feedback will really help shape this channel. Now, let's dive into today's topic. Let's start with a question. Why does zinc matter so much? Zinc is a cofactor for over 300 enzymatic reactions in the body. In men specifically, it is critically involved in testosterone production, dopamine synthesis, and sperm development, which collectively influence sexual desire, performance, endurance, and fertility. When zinc levels are low, men often experience a subtle or sudden drop in libido. Many report not feeling mentally or physically aroused, even in situations of direct intimacy. This isn't just in your head. Clinically, zinc influences the regulation of testosterone, the primary male sex hormone, and dopamine, the neurotransmitter associated with pleasure and drive. Low levels of either of these can blunt the body's natural sexual response. Moreover, a deficiency in zinc is strongly correlated with erectile dysfunction, including the absence of spontaneous erections, such as morning erections, difficulty in achieving or maintaining arousal, and even premature ejaculation. Zinc also plays a vital role in blocking aromatase activity, the enzyme responsible for converting testosterone into estrogen. In simplified terms, zinc helps preserve your testosterone by acting as a natural aromatase inhibitor. More testosterone, balanced within healthy limits, not only enhances sexual function, but also boosts energy, mood, muscle synthesis, and overall well-being. But the importance of zinc doesn't stop there. Zinc is a major contributor to nitric oxide synthesis, a compound that dilates blood vessels and promotes stronger, more sustained blood flow. In clinical studies, nitric oxide has been shown to be essential for erectile function, as it supports healthy circulation to the pelvic region. This effect is very similar to how prescription medications for ED work, by improving nitric oxide signaling and vascular dilation. Now, here's where things get even more critical. Zinc is indispensable for sperm quality, count, and motility. If you're experiencing difficulty with fertility or are actively trying to conceive, a zinc deficiency could be part of the problem. Zinc directly supports the health of testicular tissue and is significantly involved in the formation of the acrosome, the cap of the sperm cell that enables it to penetrate the egg. Numerous peer-reviewed studies have shown that zinc-deficient men often have reduced sperm count, lower motility, and DNA fragmentation within sperm cells. And beyond reproductive health, let's not forget the role of zinc in sleep and stress regulation. Zinc modulates cortisol, the primary stress hormone. chronic stress and poor sleep are two of the most destructive factors when it comes to hormonal balance, especially testosterone levels. By contributing to more restorative sleep, and by supporting a calm neurological state, zinc indirectly protects testosterone and, by extension, sexual and overall health. Now, let's talk briefly about zinc loss. One of the most common and often overlooked causes of zinc deficiency in men today is frequent ejaculation, particularly from excessive masturbation or compulsive viewing of adult content. Each ejaculate contains a small but significant amount of zinc. The body doesn't produce zinc on its own, so over time, these losses can compound, especially when dietary intake isn't sufficient to replenish it. If you're struggling with low energy, poor performance, or lack of drive, this could be a contributing factor worth addressing. If you're unsure about your zinc status, consult a licensed healthcare professional and request a serum zinc test. However, if you're experiencing any of the symptoms we've discussed, and if they've persisted over time, there's a reasonable chance you could be dealing with suboptimal zinc levels. So, how do we fix this? Start with your plate. Nature offers incredible sources of zinc. Some of the richest food-based sources include oysters, often considered the highest natural source of zinc, beef and liver, especially grass-fed varieties, chicken thighs and liver. Dark meat contains more zinc than white meat. Eggs, especially the yolk, which also contains vitamin D and choline. Cashews, almonds, and pumpkin seeds. Great plant-based options. Spinach, sardines, salmon, and other shellfish. Incorporating more of these into your weekly diet is the first foundational step, but for many men, especially those with ongoing symptoms or highly active lifestyles, including athletes, fitness enthusiasts, and those under high stress, supplementation is often necessary. Now, let's clarify something important. Not all supplements are created equal. Zinc oxide and zinc sulfate, while commonly sold, are poor choices due to their low bioavailability and higher risk of side effects such as nausea or digestive discomfort. Similarly, zinc gluconate is somewhat better, but far from optimal. The best forms of zinc, based on current pharmacological research and clinical absorption studies, include zinc citrate, highly bioavailable, gentle on the gut, excellent absorption rate. Zinc picolinate, another highly absorbable form, particularly effective for correcting deficiencies. Zinc glycinate, chelated for enhanced absorption, and well tolerated in most patients. A dosage of 10 to 20 milligrams per day is generally safe and effective for most adult men. More is not better. Excessive zinc intake can interfere with copper absorption and harm immune function. Always follow clinical guidelines or your physician's direction. Personally, I recommend zinc citrate for its impressive balance of potency and tolerability. I suggest taking it in the afternoon or late afternoon, ideally with food to enhance absorption. And here's a bonus. Zinc works even more effectively when paired with other vital nutrients. Vitamin D 3 plus K2 supports testosterone synthesis and calcium regulation. Magnesium, preferably glycinate, regulates hundreds of biochemical reactions and complements zinc's effects on hormones and sleep. For optimal synergy and absorption, space these nutrients throughout the day. For example, in morning, take vitamin D, 3 plus K2. In afternoon, take zinc citrate, and in evening, take magnesium glycinate. This strategic timing allows your body to maximize each nutrient without competition for absorption and ensures consistent hormonal support over a 24-hour cycle. If you're interested in learning the deeper science behind magnesium or vitamin D's role in men's health, I encourage you to watch our free educational videos linked below this one. These three supplements, zinc, magnesium, and vitamin D, 3K2, form the core of what I call the Trinity of men's health. Knowledge is power, but action is transformation. Take ownership of your health, your energy, and your performance. Your future self and your partner will thank you for it. Stay informed, stay consistent, and stay strong.